Hello, my name is Caleb Smith with the Rocket Miner newspaper, here to provide an update for December 28th, 2020. I'm working a little bit late this evening. I've been a little bit distracted. My cat got to unwrap belatedly some of his catnip toys and has been just absolutely adorable, trying to play with all of them simultaneously. Those of you with exceptionally good hearing or sound systems may hear some jingle jangles in the distance, but please don't let that distract you. If I can deal with the overload of cuteness, I hope that you all can as well. We've had a couple inches of snow this evening, so my general advice is if you're going to be out and about either tonight or tomorrow to just slow down a little bit, budget some extra time into your routine. That way you can still take the time to clear out the car, maybe tackle the driveway, but still not be in a hurry. This is the type of weather and the type of accumulation where if we're not more respectful to Mother Nature, she may take a bigger chunk out of us of time and possible money if we aren't more cognizant. It's just one of those stretches where, through no fault of the driver, some of the response times are going to be slower between when you make a move, when you tap on the brakes, and when the car is able to execute the whims of the driver. So just be safe. Be careful out there. That's also part of the message that we continue to hear from Sweetwater County health officials. Today, at around noon, we had our bi-monthly COVID-19 update where officials were talking about where the coronavirus stands in Sweetwater County right now. In addition to plans for the ongoing unrolling of the vaccination that's continually showing up and being administered in Sweetwater County, and just what we can expect for the next couple of months. There is plenty of good and bad news, things to be optimistic, things to still bring you down, keep you grounded and down to earth. Overall, our coronavirus figures are down, but they seem to be decreasing at a lower, slower rate than elsewhere in the state. We're up to 19 coronavirus-related deaths in Sweetwater County, unofficially. County officials note that there were multiple deaths over the week of Christmas, but some of those cases have not been officially announced by the state yet. We will provide details as they become available. In general, we're hoping in the next day or two to be able to provide some more descriptions about the people, the loved ones that we lost during that stretch. When it comes to the metrics that are often used to judge outbreaks, especially at the local level, whether that's total number of active cases, whether that's cases per 100,000 people, whether that's the percentage of positive test results, Sweetwater County remained consistently amongst the highest, most extreme cases. If you're thinking green is good and red is stop, seriously something different needs to happen, we are consistently in the red in those areas. One of the specific areas cited by Dr. Gene Station, the Sweetwater County health officer. I'm talking about the positivity rate, which is especially noteworthy because with testing being increased, the fact that we continue to have about a 17.4% positivity rate, that leads the state. Washakie County is next with about 14%, and the rest of the state is closer to 12%. When it comes to the green light standard, showing that things are improving, the goal is to have only about 4% test positive, and we're a bit of a ways from there. Dr. Station said that due to our current high numbers in Sweetwater County, she does not anticipate there being any variances granted to the statewide and county health orders that are currently in place. Those are the ones that are requiring masks, limiting crowd sizes, and restricting hours of businesses in some such places like bars and restaurants after a certain hour. She said that while it's not official, because there will be a updated numbers on Wednesday, and they'll have a chance to converse with state health officers at that time. She does not anticipate there being any variances granted for New Year's Eve. So the orders that are in place are expected to continue. As it is right now, they're supposed to continue till about January 8th, at which case Dr. Station said that she anticipates that Governor Mark Gordon and State Health Officer Dr. Alexia Harris will announce a continuation, still with the possibility for variances throughout the state in places where one of the standards that she said that they've been told to look for is that are there at least 2 weeks of low spread in an area. Though at the same time she noted that presently that's not occurring in Sweetwater County, nor does she's expected for a while. In some cases, the consequences of her actions linger. Right now, she said that they partially attribute the increased number of hospitalizations just due to decisions that were made around Thanksgiving time. And in the coming weeks, we'll be reaping the consequences of the decisions we made around Christmas. On the plus side, we are seeing more doses of the coronavirus vaccines be made available. They're focusing right now on taking care of 1A people, which are high-risk people like those who are in long-term care facilities, healthcare workers, those who are on the front line dealing with providing medical care, possibly administering tests or collecting samples or administering the vaccine. It also extends to the people, it's other first responders such as emergency medical services people, firefighters, police officers, school nurses, pharmacy workers, and even some people who are in the care facilities, such as those who work at Able Hands or Life Skills. Hopefully, as we get through this first batch, the goal is to be able to move on to people who are similarly high risk or essential workers but just weren't included in the first batch. Right now we're waiting for additional guidelines from the state, but it's anticipated that would involve people who are kind of like in the next, those who work in education, food production, agriculture, manufacturing, postal workers, grocery workers, those over the age of 75. It was noted repeatedly at this update that the vaccine is not required, but they are very thankful for the number of people who are voluntarily taking it. It's indicating that they're willing to take it and are doing so. It is noted that it also, whether it's the Pfizer vaccine or the Moderna one that we hope to be receiving copies or doses shortly, that those take two shots. There's a couple weeks in between each one, but that means that even at this rate, those who are receiving the vaccination are at least a month out from getting that strong immunity they're hoping for. And when it comes to herd immunity, that's Dr. Station defined that as when about 70% of the population has developed protection against the virus, whether that's having caught it and fought it off on their own or received vaccination. Assuming that our population remains around 43,000, which is kind of the most recent census data we have to work with, partially adjusted, that means 70% would be about 30,000 people. And just talking today about how far away we are from that. It's noted that we've had about 3,000 known cases in Sweetwater County. That's both the positive test results and probable cases. People have symptoms and have had contact with people who tested positive, but they just didn't, for one reason or another, didn't get test results to back that up. And already we've vaccinated a few hundred people. The first batch of the Pfizer vaccine was 900 odd doses, and we're told to expect more of the Moderna vaccine later this week, but that still takes time to be able to administer that and get that out there. So that means so we know we have about 3,000 known cases. Even if you double that at 6,000, let's round up and just fast forward the timeline, so that's about another 1,000 vaccinated. That still leaves us more than 20,000 people away to the degree of community defense that you know that naturally slows it. And even then, that doesn't fully stop it. That's part of the reason why people are still encouraged to get year after year get a flu shot. One of the messages that remain consistent today is that even if you get a vaccine, the expectation is that the people who receive that and those around them are still going to be expected to wear masks, to wear the protective equipment, to continue washing their hands, maintaining their distance when they can, staying home when sick. This is going to be our way of life for some time. The vaccine isn't going to change anything overnight. The hard work, the honest expectation is that every day we need to be taking responsible steps for ourselves, our family, friends, other loved ones, our community. As Dr. Station put it, it remains important for our county to protect each other. So, as we go into the new year, as we cross off days off the calendar day by day, that's what I encourage everybody to keep doing. This has been Caleb Smith, and a slightly catnip crazed cat in the background. Wishing you all a good day and a safe tomorrow. Drive careful out there and wear your mask. Bye.